Zaman, or Dr. Raj Zaman as he's well known as, is a fully qualified plastic and reconstructive surgeon. He obtained his medical degree from the University of Western Australia in 2009 and pursued several years of surgical training, not only in plastic surgery, but also gained experience in neurosurgery and general surgery. He's a fellow of the Royal Australasian College of Surgeons, ASPS and ASAPS. Dr. Zaman is going to share with us his recent experience performing complex hand reconstructive surgery in a hand trauma patient. Thanks, Dr. Zaman, for your time today. I'm wondering if you can please run through this patient's history with us.
Thank you, Teresa, for that very warm introduction. I feel very honoured to be here and share my experiences with this challenging case. So the patient was a 65-year-old lady who was involved in a serious car accident over the weekend, and she was taken to a regional hospital. Her skin and tissues on the back of her right hand were ripped away from the muscle layers underneath. And on top of that, she had broken bones on her wrist and required surgery to fix the fracture with metal pins and plates. Her skin was stitched up and some of her extensive tendons also were repaired at the time of the injury. She did, however, report that the skin took about 6 to 8 weeks to heal, which is actually quite a long time. But when she came to see us, her main issues was lack of movement at her wrist, and her fingers of her hand, which was her dominant hand. So, understandably quite limiting. And her main issue was she couldn't hold a cup of coffee in the morning, and she really likes her coffee. So there were also pins and needles and numbness in her thumb, index, middle, and ring finger distribution, i.e. indicating a problem with the median nerve. But prior to that, she's otherwise fit and well, non-smoker, and she had a normal hand function.
Wow, okay. So it's her dominant hand, isn't it? So it must have impacted her quite significantly. What did you find when you assessed her?
Yeah, absolutely. I found her skin to be very tight across the back of her hand, which reduced her wrist move, particularly forward, especially her ability to, forward. But the tendons on the back of her hand and wrist were particularly stuck to each other, to the skin and tissues underneath. And the thumb side or the palm side wasn't too bad, but I suspect, given the crush injury of the actual injury itself, I suspect that the tendons and the nerve on that side was injured too. But so we had a few goals to fulfill in this case, which is obviously quite challenging.
It certainly sounds quite complex, involving, multiple systems. What did you do next with this patient?
Yeah, like with any complex problem, we start really at the beginning. And so we started to do some investigations first. And so she had an MRI scan to really assess the soft tissues underneath, including the tendons and muscle. And then, as well as that, we did a CT angiogram to assess the blood supply of the hand, and also in preparation for what we thought we were going to need some tissue transplantation and complex microsurgical reconstruction. After the review of the scans, we planned a surgery, which included cutting away all that scar tissue on the back and the palm side of the hand, freeing up the tendons and nerves from the scar tissue that they were stuck down to, as well as freeing up the carpal tunnel where we had preoperatively some median nerve symptoms, and then transplanting new skin, tissue, and blood vessels taken from the groin, also known as this groin skip flap, to fix the tissues of her hand.
Wow, from beginning to end, how long did it take you?
Well, certainly, Teresa, it was a bit of a marathon. It took about 10 hours, but I was very fortunate enough to be able to work with my mentor and colleague to complete all of the surgery required. And I guess one perhaps could say that that's probably the easy part for the patient, and the real hard work begins for them after this surgery. And certainly working in an excellent multidisciplinary team consisting of a seasoned hand therapist to provide follow-up, motivation, and therapy after surgery is absolutely critical for improved outcomes.
So where is this patient now? What's the outcome? What's she like?
Yeah, look, post-operatively, she was in hospital for several days for flap monitoring, and following discharge, she commenced intensive hand therapy with the senior therapist. And now fast forward 9 months, and whilst her range of flexion and extension has improved significantly through her hard work with the therapist, it's not perfect, but it's still early days. But importantly, she can now grip her coffee, and she says that everyone in her family is happy. So I think we've achieved something there, which is good. But also, I think that's the key message here to highlight to these patients and the general public at large, is that with complex traumas like this, we can always aim to improve the current limitations, but it will never be perfect, so to speak. And so, but certainly being motivated like she was and patient during this journey, it certainly goes a long way. Setting realistic expectations for patients like these ensures good rapport, not only with the surgeon, but with the patient and the hand therapist. So I do want to thank all the amazing therapists around the country who make significant difference in patients like these through their ongoing commitment to just push that little bit extra 1%. And certainly, as Sterling Burnell, who's one of the founding fathers of modern hand surgery, once said, to someone who has nothing, a little is a lot.
Thanks, Dr. Zaman. I'm sure the patient was very appreciative of your expertise. For further information on plastic surgery procedures on our members, please visit our website on www.plasticsurgery.org.au.